Welcome to the Pain Relief Path podcast, where I dive into the vast world of chronic pain with the occasional help from knowledgeable guests from diverse disciplines that impact your chronic pain. I am your host, Dr. Pan Zhang, physical therapist turned chronic pain coach. I'm here to educate, empower, and encourage you to find your path to a pain-free life. Thank you for listening. Enjoy. Hello, and welcome back to Pain Relief Path. My name is Dr. Pan Zhang, and I am your chronic pain coach. So today we are going to kick it back to basics, and we're going to just talk about pain, and specifically the types of pain that, as kind of a medical community, we've come to realize there are three main types or categories of pain. And this is something that's actually fairly new, and there might be different names out there for for each category, but this is what is kind of accepted mostly. But you'll hear a couple different types of names, and I'll give a couple different options for each one, for each category. So this is really important to understand what the different types of pain are, because it really highlights, each type of pain highlights how your body, your mind, and your stories affect your pain experience and how they kind of interact with each other. And also, just knowledge is power. Understanding when you have one type of pain versus another type of pain, it's really easy to delineate, oh, this is why I'm feeling this way now, or this is why this is going on for so long, or when I bump my knee, it doesn't feel like the pain that I have every day. And why is that? Well, because they're kind of different pathways. They trigger different parts of the pain cycle. Like I said, it's about the body, the mind in the stories, but each type of pain will kind of highlight or focus on a specific section, or sometimes different combinations of those. Now, one thing to note is that even when we talk about, pain specifically in the body, there are still contributions to your mind and from your mind and your stories. However, those contributions might just be smaller. So it's more like one section is highlighted over the other. It's not that it's just a body problem, or it's just a mind problem, or it's just a stories problem, but rather it's just different kind of combinations or contributions from each category there. So let's just dive into it. So there are three main types of pain. There are, the first one that we'll talk about is called nociceptive pain. The second one is neuropathic, and the third is nociplastic. I know there are three N's. They're all there. It's all kind of a little confusing. I totally get that, but we'll talk about some alternate names that are commonly used for each of these. These are a little bit more scientific, if you will. So for the first one that we're going to talk about, the nociceptive pain, and this is the first one we're going to talk about because it's the simplest. Everybody has some experience with nociceptive pain. And so nociceptive pain is basically acute pain, or pain that is caused from your musculoskeletal system, or potentially your organs, from your GI system to hormones, things like that. So this is specifically pain resulting from tissue damage. So if you sprain an ankle, if you break a leg, if you bruise, if you undergo surgery, something like that, where your tissue is actually damaged or changed, this is nociceptive pain. And this is very much more of a body issue. The body is really the front and center here. However, like I said, just keep in mind, even though your body is front and center, the stories that come with an injury and how you perceive that injury is really, really important in your healing process from that specific injury, and how and if that specific injury can potentially become a chronic issue. And we'll talk about that once we get to nociplastic pain. But nociceptive pain is an acute injury, like I said, anywhere from after surgery or after a sprain. A paper cut technically is nociceptive pain. It's a pretty wide range, a wide variety there. Even if you want to think about like gut pain or something like that, it is tissue injury or tissue damage that is causing this pain. It is it is what most people think of when they think of pain. And I think that's a key here with nociceptive pain is when people say that, oh, you're in chronic pain, and they look at you and they're like, well, you look fine. It's because in their mind, they are thinking nociceptive pain. They're looking for tissue injury specifically. And most people, when they think of pain, they think, oh, your tissue has to be injured to have pain. And that's simply not true. Like I said, that is one type of pain, but your mind and your stories significantly impact that pain experience. And for a lot of people, especially once you dive into more chronic issues, and if you've had issues outside of just, stubbing your toe, your stories and how your brain affects that pain and that pain experience can make it a very, very short experience or a very, very long experience. So that's something to keep in mind. And it might be something that is frustrating for you when you're saying, oh, I'm in pain, and your friends or family are frustrated because it doesn't look like you should be in pain. It's because they think that pain is just a nociceptive issue. That's all they think is it's just a tissue damage issue, but that's not necessarily the case. The second type of pain that is the most common is neuropathic pain. And this is definitely more still body effects, but you have a little bit more of your mind component here. So neuropathic pain is specifically nerve pain. And this gets a little bit tricky because your brain is a big part, well, it's your central nervous system. Your brain makes up where your nerves come to converge and talk to each other, and your brain figures out what's what. So your brain is a part of your nervous system. So if your brain is not functioning or firing properly, and it's not kind of connecting the dots properly, it can definitely impact your peripheral nerve pain, which is basically nerve pain that is happening in your body. So nerve pain, neuropathic pain, can come from things like just neuropathy, such as diabetic neuropathy. This is going to feel like numbness, tingling, which can be painful, burning, like a deep ache that won't go away, sometimes stabby pain, that's like sharp stabby that just like kicks you in the butt out of nowhere. That can be nerve pain as well. And main or big diagnoses are things like sciatica or sometimes plexus injuries for the arms or the shoulders. But sciatica is a big one that a lot of people can understand and relate to, or maybe have had experience with. But basically, neuropathic pain is when your nerves are not functioning properly, whether it is typically in the periphery, whether there's a nerve injury, whether it's a crush injury, or like an irritation where there's inflammation around the nerve, or it can be in the spinal cord where it could be caused from like a disc issue or stenosis or something like that, all the way up to the brain, where if you've had a nerve injury but that's resolved, but your brain is still really, really sensitive and causing that area to be very, very sensitive, it can lead to things like CRPS, which is essentially a nociplastic issue, which we'll get into in a second here. But it can definitely prolong the nerve symptoms if your brain firing, functioning, and bringing all that information together is not functioning properly. So that's neuropathic pain. The last piece is the nociplastic pain. And this pain is the type of pain that we work on specifically. So this is the pain that has the biggest contribution from your body, your mind, and your stories. For a lot of people, the body issue, the tissue injury, whether it's, muscle, skin, tendon, nerve, though that issue's already healed, the body has physically healed that injury, but there's still issues there because of the stories that we kind of have in ourselves, and also how our brain reacts to the pain sensation or the pain signals, whether it is something that we think is very, very detrimental or something that we are expecting. or it's something that creates a lot of fear in us, which can release an entire cascade of other hormones and issues that can prolong and further sensitize our entire system. So, nociplastic pain, like I said, is also known as chronic pain, or it can also be known as central pain or central sensitization pain. If you're hearing chronic pain, central sensitization, CRPS, or nociplastic pain, that is all basically the same thing. Again, CRPS is technically its own diagnosis, but I have heard a lot of people not really understanding what CRPS is use that in conjunction with nociplastic pain. Nociplastic pain doesn't just come out of the blue. This is something that develops over time, and usually this starts off with an injury or some sort of insult to the system. So whether it is a injury such as like a sprain or a break, or an insult to the system might be something along the lines of a flare up of your GI issues. If you've had Crohn's disease, if you've had IBS or something like that, that causes pain, or even something along the lines of like endometriosis. Every time you have like an endometriosis flare up, that sensitizes that whole pain cycle and loop, so that every time you flare up, sometimes, especially if there's a lot of fear and stress involved with that flare up, that can kind of ingrain into your system and cause that loop, especially in your brain, to become more and more sensitized. And then the stories that you tell yourself about that flare up, whether it is along the lines of, this is bad, I'm broken, this is something to be very fearful of, that again can really heighten that feedback loop of pain and make each pain episode and experience even more sensitive and even more painful, honestly. And typically, like I said, this usually starts off with an injury or some sort of insult to the system, some sort of flare up, and then you leave it untreated, or there is an addition of trauma, your cultural perceptions and your social perceptions of what pain is and what that means to you as a person and what that means to your life currently, your future, your past life, and then also just in introducing stress and maybe even poor mindset. If you have a negative outlook every time you have a pain episode or a flare up, if you think, oh no, this is it, this is going to be my life from here on out, you're priming your whole nervous system, your brain, your stories, and your body to further be sensitized to the signals that are happening in your brain, as well as the hormones that are released during a pain flare up. So because this cycle continues to feed on itself, this is where I come in. This is what I do as a chronic pain coach. So I will help some people with their body issues. If you are still having some tissue issues or nerve issues, as a physical therapist, I have had 13 plus years of experience with this. However, a lot of people don't need me for this because they've already found practitioners, hands-on people in the area, in their area, that have really been helpful. It's just not helpful long term. But what they really need, and what people typically dealing with nociplastic pain need, is help with their controlling their mind and changing their stories so that they serve themselves a little bit better. And addressing the mind and stories issues, but also making sure that you are putting all the pieces together in a way that best serves you. For instance, this is not a one size fits all type of treatment. Chronic pain is so individualized because everybody's mind responds to pain and experiences differently, and everybody's stories are different. Even though we might all grow up in kind of the same society or culture, your individual perceptions of pain, what your parents taught you, what your friends have taught you, even subconscious things like how your parents reacted when you fell down as a child, that all really affects your perception of pain and how your body and your system processes everything. So My role is to help people bring all three of those puzzle pieces together and put it together in a way that makes sense for them to help them understand where the majority of their pain issues coming from, whether it's your body, your mind, or your stories, and then be able to tackle each section for themselves and give people tools and understanding and knowledge to be able to go and find their individual pain-free path. So I hope that this was helpful for you, understanding the three different types of pain: the nociceptive, or your acute pain, tissue injury pain, your neuropathic. This is your body's, this is your nerve pain. It's neuropathy. It feels like burny, tingly, numbness, achy, and this is where your body and your mind particularly come together. And the last piece is that nociplastic pain. And if you're in chronic pain, this is the type of pain that you are having. And this is where your mind, your body, and your stories all play a huge, huge role in your pain experience. So I hope this was helpful for you. If anything, hopefully this episode helps you help other people understand your pain. So if you want to share this episode to your friends, family, so that they understand that nociceptive pain is not the same as nociplastic pain, which is what you're dealing with, and why it's different, that can be really, really helpful for them to help you along your path as well, and at least provide some understanding for them to see where you are along your journey. Okay, so hopefully this was helpful for you, and I hope you guys all have a fantastic week, and we'll see you next week.